not well in any capacity, nothing else matters. And I don't think people truly deeply understand that. Not
Right.
even people when they're ill do they truly understand that. Like your house, your car, the vacations, the dog, none of this matters. If you are not physically or mentally well, sell it all. Get rid of it all because like I mean at the end of the day if you cannot live in your body, what do you have, right?
Polish in my hand, I'm ready to create each nail a masterpiece. I can hardly wait. Soft pastels or vibrant hues, each tells a tale in their artistry of nails. Nothing ever fails. With each swirl and twirl, let the magic begin. In this kingdom of gloss, there's no end to the wind. Gloss on my fingertips, watch them shine bright. Painted like a canvas, colors taking flight. Feeling fierce and fabulous, I'm ready to ignite. Slaying the nail game every single night. Nails and beauty talk with Asia the Bird. Nails and beauty talk with Asia the Bird.
Hello, everyone, and welcome to Nails and Beauty Talk. I am your host, Asia the Bird. Today, we have a very special guest with us today. She is the founder of the Cancer Freedom Program. Please welcome Dr. Amy Morris. Hello,
Thanks.
Dr. Amy, and welcome.
Hi. Thanks for having me here.
Yes, absolutely. You're most welcome. So I want to go ahead and ask, where are you originally from and tell us a little about your upbringing.
Yeah, so I'm Canadian. So I grew up in Western Canada. I grew up, really normal childhood, really rural. I have many brothers and sisters. I have one brother, many sisters rather. And yeah, I just had like a really normal, healthy upbringing.
That's really, really cool. So tell us about like your school experience, like grade school, college, things like that.
Yeah. So after I graduated high school, like I mentioned, I grew up really rural. And after I graduated high school, I started going to university. Like you have to travel away from home in that
Right.
case because you're so rural. So I
Mhm.
went to university at the closest city. That's where I did my undergraduate degree.
Mhm.
And my undergraduate degree was in pharmacy.
Wow.
So I really developed a love for both like chemistry and pharmacology, like how
Mhm.
drugs and herbs work in our body to elicit a response or to treat illnesses. And it
Right.
just, the aspect of that I loved was like, it was always changing, it was always evolving. And to
Mhm.
me, like as to someone that's intellectual, that is like candy, right? To just
Yeah.
always have something new to figure out and learn, that's amazing. So that's where I really started my university education. Once I finished from there, I did additional training to specialize in a hospital setting. Not every pharmacy graduate does that. I
Mhm.
did that in my specific scenario. So it's an intensive training that only a few
Mhm.
are selected to complete. That
Mhm.
allowed me to have a better practice in acute care. And
Yeah.
then after that, I went and started practicing. So I started my career in oncology. I worked
Oh,
in
okay.
cancer care. I just kind of gravitated towards that area at the time, not really knowing why I was picking that.
Mhm.
I like the drugs, I like the people. So I started there, but
Mhm.
then after a while, I realized like I needed even more training. So
Mhm.
then I went to University of Toronto and I did my doctorate degree there. So I have
Mhm.
a postgraduate doctorate degree, University of Toronto, and then I came back to my hometown, started practicing again, and that's where my life kind of got derailed.
Wow. I want to get into as far as sports. You used to be an award-winning weightlifter. So what drew your interest like, in sports?
Yeah, I've always been athletic my whole life. So I was always involved in track and field, volleyball, like curling, whatever. I was always
Yeah.
athletic. Now, for me, when I was went to university, I started dating my now husband. And he was involved with competitive weightlifting.
Mhm.
And he was like really hesitant to
Mhm.
teach me I don't know why. Well, I think I do know why. I think the reason why I was so hesitant is because he thought I would like dabble in it and not really stick with it, and it'd be like a waste of time, right? But
Yeah.
he taught me how to start weightlifting. Quickly realized, like, body proportions wise, I'm built for weightlifting. I have really
Mhm.
short legs. I'm like the opposite of, like, every girl's dream. Essentially, I have like the shortest inseam, and that makes you built for lifting heavy weight. So I
Right.
quickly excelled in terms of weightlifting, and him and I both went on to compete on the national and international teams for Canada. We both went on to be
Wow.
coaches, referees, and I don't competitive weightlift anymore, but
Mhm.
that's kind of how I started down that avenue.
Oh, wow. I want to get into as far as your experience with ovarian cancer. So, tell us about your ovarian cancer survivor story and what was your reaction when you first found out you had cancer?
Well, when I was diagnosed, it was 2016, and
Mhm.
I think in 2016 I was like the healthiest I'd ever been, you know.
Mhm.
I was lifting weights like 3 to 4 times a week. I was, like, physically active, running. I had a
Mhm.
great job. I had just gotten married, just bought our
Mm.
first house. Like, I had no family history of cancer. I have 4 sisters. I have 5 siblings, 4 sisters. Everyone was healthy. So it was pretty much out of the blue, which is a story that rings true for a lot of cancer survivors, I think. It was really unexpected. I was 30 years old at the time.
Mhm.
And what had happened is that I had recently been married, and we
Mhm.
went on our honeymoon to Italy and Greece.
Mhm.
And we did Italy how you should, which is like
Right.
eat your way through that country, essentially,
Right.
right? And so
Right.
we ate like pizza and gelato. And when I got home, I had gained some weight,
Mhm.
understandably. But
Mhm.
what I noticed is I didn't lose the weight. And if anything, I continued to gain weight.
Wow.
And then I was like, okay, that's kind of weird. But what really pushed me to go see the doctor, like what really was like this is not right, was I had heartburn. I had a
Wow.
heartburn all the time. I had a heartburn constantly. And I just thought, this is weird. So, like, I didn't think cancer. I thought, well, I must have an ulcer, or I don't know. So I just went to the doc, and the doc was like, hey, look, let's do some routine blood work, but let's also do an ultrasound. Let's do an ultrasound of your abdomen because, women can have odd things happen with their
Yeah.
ovaries, like cysts or fibroids, or like, is this like what's going on here? So let's just do an ultrasound, start there.
Mhm.
And I'll never forget because she called. It was 5 p.m. on a Friday, and I was
Right.
standing at my kitchen counter. And she said, I'm surprised you didn't notice anything because there's a tumor on your ovary the size of a football. So it's
Wow.
21 centimeters by
Wow.
10 centimeters. And she said, okay, look, like, things grow on women's ovaries. You can have a big tumor on your ovary and it's not cancer. Okay. So let's just see. I'm going to send you to a specialist. Let's just see what it is. And we'll go from there. Okay.
Okay.
Don't freak out. Right.
Right.
So I,
Mhm.
to- so I totally freaked out. Okay.
Mhm.
Um, my entire world like dropped from underneath me. This is what my entire life became about now.
Mhm.
Because if you're not well in any capacity, nothing else matters. And I don't think people truly deeply understand that. Not
Right.
even people when they're ill do they truly understand that. Like your house, your car, the vacations, the dog, none of this matters. If you are not physically or mentally well, sell it all. Get rid of it all because like at the end of the day if you cannot live in your body, what do you have, right? And so for
Right.
me it became all about that.
Mhm.
Eventually, scans later, follow up later, it became obvious that this was cancer. It was stage 3 ovarian cancer.
Wow.
And then I needed to started my treatment and recovery from there.
Wow. So as far as like the heartburn and stuff like that, was you going through that like for a week? Was it like months in terms of like the symptoms or
It was probably like less than a month, I would say. It was
Wow.
really it came on fast and it was really persistent. Now, I've shared my story online for like since I've been diagnosed. So 7.5 years I've been sharing online about my
Mhm.
cancer experience and helping women with cancer. And so I have received some feedback from people in terms of my story, right? Some
Mhm.
haters, some trolls. And so what some people will say to me is, how dare you share your symptom was heartburn? Because now everyone's going to think they have ovarian cancer when they have heartburn. Okay.
Mhm.
That was my symptom. Okay.
Right.
That story is real. And if you have persistent heartburn, you should go check it out. Like, whether it's cancer or not, I'm not sure, but you should go get it checked out.
Right.
Okay. Because we know ovarian cancer is the silent killer. That's what it's called. And
Mm.
so typically the symptoms are going to be like bloating, constipation, painful sex. But I didn't have that. I had
Right.
maybe mild bloating, like what I maybe I look like I had just eaten a bunch of Chinese food or something. Like that's it. It was
Mhm.
mild. I didn't have those other symptoms.
Right.
I had subtle weight gain and heartburn, and that was it.
Wow. Now, in terms of just your experience dealing with cancer, what were some of the remedies or treatments that you found that helped you overcome it?
So during my treatment, I needed to undergo intensive surgery. So the
Mm.
tumor was so large, it had engulfed one of my ovaries. So I needed that tumor and the ovary it was involved with removed. I
Mhm.
kept the remaining ovary. My remaining ovary had cancer in it still. I
Mm.
made the decision to keep that ovary. I was newly married. I was 30 years old. There are serious
Wow.
consequences if you have your ovaries removed at the age of 30. Now, not to say that's not going to be the path for everyone diagnosed
Yeah.
with cancer. Like some women are going to choose to have a total hysterectomy. Some women will follow the advice of their clinicians and go down that path, and I respect that. That wasn't the path for me, and both my oncologist and I felt like we could treat it.
Mhm.
So that's a path I chose. So I went through
Mhm.
surgery, and then I went through intensive chemo, and when I
Wow.
got to the end of that, I was cancer free.
Wow. Wow. I want to get into in terms of the Cancer Freedom Program. So you created a program called the Cancer Freedom Program. Tell us about this program and what was the mission behind creating the program?
Yeah. So after I finished my own treatment, something became really obvious to me. Like when you get to the end of your cancer treatment, you think cancer's done when chemo's done, but it's not.
Mhm.
The cancer and chemo side effects last for months and years after you're done treatment.
Wow. Okay.
If you think about a breast cancer survivor, she'll be treated for, at minimum, a hormone positive breast cancer survivor will be treated for a minimum of 5 years.
Mm.
So she's going to get probably some kind of chemo, then surgery, then radiation. Then she's going to probably get another surgery. And then she's going to get put on anti-hormonal therapy for 5 to 10 years.
Right.
This is like a long-term game here. This is not like a blip. So for me,
Mhm.
when I finished my treatment, I was like a shell of the person that I used to be.
Mm.
I was bald, obviously. I had gained 20 pounds during my treatment, steroids and emotional eating and being perimenopausal. I I was drenched in hot flashes. I was 30 years old and menopausal.
Wow.
And I remember thinking, well, this can't be right. Like this can't be it. So I said to my
Mhm.
oncologist, like, look, this is how I'm feeling. Like I'm exhausted. I
Right.
like barely recognize myself. And he's a great oncologist. He really is. But he said, yeah, like that's like the price you pay for being cancer free. Like that's that's the exchange here, like this, you're
Mhm.
not going to feel like yourself anymore. And I just thought, I'm not going to live like another, what, 4 decades, 5 decades to be a shadow of the person I once was. So I was like, no, there's got to be a better way to do this. And at that point, like I was a cancer researcher myself. I had been a principal investigator on numerous studies. I was a clinician. I had a doctorate degree in the matter. I was like, if
Yeah.
someone's going to figure this out, it's going to be me.
Right.
And so that's where I was like, dove in. I spent years researching from cancer recovery and remission. So at that point, I shifted my career from helping women during treatment to helping them after treatment to get rid of their side effects and stay cancer free. Like that became my mission. And so that's what really pushed me, is like my own experience knowing that there's just not support in recovering from cancer. And so that's what pushed me in that direction. And that's why I ultimately created the Cancer Freedom Program.
Yeah, absolutely. So what has been some of the success stories and conversations surrounding your program?
There's honestly so many. We've helped 450 women through the program.
Wow.
So we've helped a tremendous number of women in the program. I think like the biggest successes come when women are truly given their lives back. Like not in a sense of like they're no evidence of disease and cancer free, but in a sense of like they're free from cancer. They're free from like the side effects and the anxiety, the fear. Like they truly feel like cancer, they can like hardly believe it actually happened to them. That's like the true success that we strive for in working with women. That's how I measure success. Is like it feels like a bad dream that's just fading into the past.
Yeah.
And so what that looks like on a more micro level for women is like they regain back their energy. Like they come from being exhausted after cancer to like they're fully energized again. Now that we can accomplish really quickly. So women will go like months and years being exhausted. We can fix their energy in about 3 weeks. What I do is I start with a cancer audit and I identify what's going wrong. So I want to look to see, why do you still have these side effects? Like, why aren't you actually recovering fully? And what is your risk of recurrence? So like, what are the modifiable factors that we can change right now that are increasing your risk of cancer? Okay. So that's how I start. And once I identify what's going wrong, like where there's opportunity for improvement, and we make changes, it's about 3 weeks until you're fully energized. Okay. So that's my favorite to work on, because it's like seeing the light inside of someone come back on, right?
Yeah.
It's like just seeing them come back to life. That's really my favorite. And now, of course, we've had tremendous weight loss stories too. We've had women that want to lose, like they've gained 50 pounds. And we know that being at a high body weight or an unhealthy body weight increases your risk of recurrence. We know that to be true from literature. And so when women come to me wanting to lose weight, I take that really seriously, because I know it's not about vanity or how you look. It's about health. And so we've had women drop over 50 pounds working with us. Yeah. So just like really coming back to who they want to be, like a more enlightened version of themselves than even before cancer.
I want to get into as far as wellness and diet. So for someone looking to change their diet to prevent cancer or to overcome cancer, what are some of the best foods for fighting cancer?
So this really needs to be curated to the individual. Okay. I get asked all the time, like, can you just give me a list of foods to eat and foods not to eat? And I can, but it's not going to make much of a difference. Like, it's really not going to drop your cancer risk that much. Okay. Because it really needs to be customized to the person. So your height, weight, if you've had any medical history or cancer diagnosis, what type of cancer, what type of treatment did you have? How are you feeling now? Like, are you low energy? Are you having hot flashes, joint pain? Like, so we really have to customize it to you. Once we do that, we know we can drop your risk of cancer by about 60%. So like 60%, but it has to be customized to you. Okay. So we know certain things to be true in terms of food. Okay. We know that 2 foods have definitely been linked to cancer. The first is processed meats. So this could be deli meats, lunch meats, bacon, sausage, hot dogs, charcuterie boards, like those
Right.
types of meat have been linked to cancer. They just have.
Mhm.
Okay.
Right.
The second food is not really food, it's a drink, but it's alcohol. Okay.
Mhm.
Alcohol is a toxin. It's a toxin. Unfortunately, we love it socially and culturally. And
Right.
if that's you, I totally get it. That's how I was brought up and raised. Like, alcohol is like a social and a celebratory event.
Mhm.
If you can't fully quit it or you don't want to fully eliminate it from your life, I get that. But at least try to minimize it. Because we know that
Mhm.
women that drink more than 3 drinks per week, they
Mhm.
have about a 9% chance of developing cancer. Okay. So,
Mhm.
like, if you're a cancer survivor, a 9% increase in your risk, that to me feels too much for my risk tolerance.
Mhm.
But if you drink less than 3 drinks a week, so then your risk is about 4%. So you
Mhm.
cut your risk in half. So if you can't fully quit alcohol, just minimize it then.
It was the garage
Oh,
downstairs.
I didn't even hear it. I didn't even hear it.
Yeah, yeah. So, yeah, absolutely, most definitely, yeah. And I remember you talked about how alcohol and processed meats could, can be the culprit as far as with cancers and things like that. And I think what I like now is that people are getting more mindful of what they eat, especially what they put into their diet. That's even like with me. I'm getting more mindful of what I put into my body and stuff like that, or at least have a balanced diet of some kind. You know
Oh.
what I mean? And is not like, eating a lot of sugar or dairy and things like that. So finding like alternatives to those things.
Yeah, like, look, your body is this miraculous machine
Mm,
and you need to fuel it.
mm,
I mean, period. Okay. Because,
yeah.
like, look, we have so many people that will say, look, cancer is just genetic Russian roulette, right?
Mm,
You have no control. Just go live your life. Like, just go enjoy, drink your beer, your wine, eat your hot dogs, just go live your life. You have no control. Okay. That's
right.
bull. That's bull. That's
Yeah.
that's a lie.
Yeah.
There's elements of my cancer story where I'm like, I don't know why I got diagnosed with cancer. I was healthy. I was trying. But were there things I could have done better? Oh, absolutely. Absolutely there were. So it's a little bit naive to think, "Oh, well we have no control over this." Your
Mm,
diet for sure not only impacts your ability to tolerate your cancer treatment, like minimize your side effects during treatment, but that's
mm,
going to change your cancer risk
right.
significantly. So at some point, like, we have to say, okay, yes, it was not fair that you were diagnosed. It wasn't fair that you were dealt this genetic hand. Okay. But it is your responsibility to do something about it now.
Yeah. Yeah, absolutely. So I want to get into as far as like remedies for chemo brain or chemotherapy. So what are some remedies for overcoming symptoms of chemo brain and chemotherapy?
Chemo brain specifically. So, chemo brain is often described as like brain fog or like some element of cognitive decline after receiving chemotherapy. Okay.
Hmm.
Now, chemo brain's multifaceted. Okay. Like, look, you've gone through this traumatic experience. And whether you want
Hmm.
to call cancer trauma or not, it is, right? Trauma, the
Yeah.
definition of trauma is anything too fast, too soon. So
Yeah.
that's cancer. So we can get a lot of brain fog or cognitive decline from traumatic events, but there's also like a pharmacological element to this that's
Hmm.
impacting women neurologically.
Hmm.
So for chemo brain specifically, we know that a lot of it's governed by your foods. We know flavonoids play a risk in terms of minimizing or recovering chemo brain. So so it's clear that we can use nutrition to get rid of these side effects. It's clear from the literature and practically we've done it hundreds of times. So these are options that you can use. I think lots of times when we go to physicians or our oncologist and say, like, look, I have chemo brain, I have exhaustion, I have joint pain, they don't have great solutions for us. And it's not because they are bad docs or oncologists, like, not at
Right.
all. It's because that's not their scope of genius. Like, we need them to be so good at getting rid of cancer, right? I needed my
Right.
surgeon to be a very good surgeon. I didn't need him to also guide me in terms of the exercise I should do after cancer. Like just stay
Right.
in your scope of genius because I really need you there. But understand as a patient and a client, you need to go somewhere else to get this other expertise. Don't rely on like your oncology team to help you from start to finish with that.
Mm. I want to get into in terms of exercise. So, what are some exercise you would recommend for someone with cancer or to prevent cancer?
Yeah, so this is where the most compelling literature is, especially over the last 10 years. It's really exploded. We now have studies that involve tens of thousands of women specifically. Majority of the literature is in breast cancer, but it's so compelling that we've applied it to every type of cancer now. So we
Mm.
know that if you hit target exercise levels, you lower your risk of a cancer recurrence by up
Mm.
to 59%.
Wow.
Yeah, so it's better than a lot of drugs on the market, you
Yeah.
know? But we
Mhm.
also know that only about 4% of cancer survivors are actually doing that. So we
Mm.
have something that will cut your risk by more than half, but only 4% of us are using it. That like kills me, right? So there's
Mhm.
two pieces to targeted exercise. So there's
Mhm.
two things you need to do to hit these levels. The first is low intensity cardio. This is like walking.
Mhm.
It's like walking, and start there. Like everyone can walk, right? You
Mhm.
either have like a sidewalk or the side of a road or walk around your house. Like
Mhm.
everyone, you don't need any equipment. Like everyone has access to that. So start there. Okay. And
Mhm.
I would start wherever you're at right now. I would track to see where you are. Like, do you do any walking? Then start if that's where you're at, that's totally fine. Then start with like a
Mhm.
5-minute walk every day. Go 5 minutes after
Mm.
supper every night. That's it. Okay. And then we'll work you up. Right. So that's the
Mhm.
first part of targeted exercise. The second part is you've got to do strength training. You've got to strength train. It's got to be progressive overload and it's got to be done in a really intentional way. Now,
Mm.
many women shy away from strength training, right? Like we've just never been exposed to it. Like depending on your age
Right.
category, you've never been exposed to it. You're intimidated by it. It
Mm.
just feels like foreign to you. Okay. Start strength training with just your body weight. There's so much you can do with just your body weight. If you can do push ups to your wall, right? Body weight squats, body weight lunges, like start there.
Mhm. Yeah, absolutely. So, looking back at your career and your experience with cancer, what were some of the life lessons that you learned in that journey?
Oh, well, I mean, how could you distill it down to just a few things, right? Like I'm forever changed because of that experience. The the part that I'm really grateful for is that I was working in cancer care before I was diagnosed. So
Mm.
I already had this tremendous understanding of the pharmacology, of the scans, the disease, the diagnosis. I knew all of that. Like even as my own oncologist was talking to me during my diagnosis, my mom and my husband would say like I was like 4 steps ahead of them and questioning. I'd be like, what's going on with my liver? Oh, there's no fluids. Okay, that bumps me to this stage. Okay. So I already had this tremendous amount of knowledge, but I didn't have
Mhm.
the practical aspect of going through it myself.
Mm.
And right now, I'm extremely grateful to have this like 360-degree view of cancer because that's what
Mm.
makes it like powerful for me to fully understand this from such a deep level.
Mm. Now, I want to get into as far as just community because I think you've mentioned a couple of videos on your YouTube channel about community. So, how important is for someone who's going through cancer, who has just been diagnosed with cancer, or trying to prevent cancer? Like, how important is community?
Gosh, you probably heard the saying of you become the average of the 5 people you spend the most time with, right? You probably
Mm.
heard that saying before. Like you become the average of the people you expose yourself to.
Hmm.
So if you're in a Facebook group or a support group where people are constantly negative, right? Where
Hmm.
people are like, I'm having a recurrence or I'm so scared or I like it's so dark, I'll never get through this. Like if you are surrounding yourself with people who have a victim mentality, then you're going to come to that level. And not to say like people shouldn't share how they're feeling. Of course they should, right? But you
Absolutely.
want to surround yourself with people who are going to lift you up, right?
Yeah.
It's become so much easier for you to get to the other side of cancer and to thrive after cancer if you can see women ahead of you do that. If you can
Mhm.
see someone on the path ahead of you, then you can follow them, right? But if you're
Absolutely.
just by yourself, then you're thinking, well, this is just my reality. I'm destined for this. Okay. So that's where
Mhm.
community becomes like everything. And I've shared a YouTube video about my experience with cancer support groups. I was really, I think a kind way to put it would be like honest about my
Mhm.
experience. I was blunt about my experience. In my YouTube video about cancer support groups, I'm blunt because I'm like, this was a toxic place for me to be.
Mhm.
And so everyone, like the first thing you do is join a support group when you're diagnosed. Those
Mhm.
you go there hoping to get support, and sometimes they're the least supportive communities. Okay. So not to say like all of them suck, but be careful, right? And if you
Right.
find like you're constantly triggered by a group or a person, then remove him. Then remove that exposure to you. Because this, again, this without your life, without your health, physically, mentally, none of this matters, right? Community is everything. Sisterhood is everything when it comes to cancer.
Yeah, absolutely. I want to also get into this other aspect of things in terms of like dealing with stress. Like for someone who's also going through cancer or who is just diagnosed with cancer, how does one manage stress?
Isn't that something I feel like we all navigate in all aspects of our lives, right? Like to
Hmm.
manage stress in an appropriate way. Because here's the thing, like a good amount of like stress can be good in small doses, right? This
Yeah.
is how we're conditioned to be. But in overwhelming amounts, we start to get an inflammatory reaction in your body, which
Hmm.
can put you at risk of further disease, right?
Hmm.
So my guidance on this is always, and I kind of alluded to it in your last question, but if something's truly triggering you, then remove it. Okay.
Right.
Like get rid of it. And people will often say, like, there's so much conflicting information online when it comes to
Hmm.
cancer. Like, there's so much conflicting information and it just stresses them out, right? Because this
Hmm.
cancer influencer is saying this and that one's disagreeing and all these things. But what I would suggest you do is find an expert in the cancer space that you truly trust. Okay. Someone that you like them, you like how they deliver the information, you like their
Hmm.
energy, their personality,
Right.
but also that they have formal training in the area.
Hmm.
Because my cancer experience, although it was incredibly powerful, this is not what prepared me to help other people with cancer. I had one type of cancer, one diagnosis, right? I didn't also have breast and cervical and colorectal and lung and prostate. And like, that's not what happened, right? And so,
Hmm.
what prepared me to support other cancer survivors was my formal training. Okay.
Hmm.
I see so many women when they're like, oh, I followed this guy who told me to eat like this. I'm like, he's a man. He's a man, right? You had a
Hmm.
hormonally driven cancer. You can't eat the same way a man ate that got colorectal that makes no sense, right? And
Right.
so you really need to find an expert that has formal training so that they can help a variety of cancer diagnoses. And someone you really like, find one
Hmm.
or two of those people and then unfollow the rest of them.
Hmm.
Unsubscribe. Like, I'm serious because, like, if you have too many external voices telling you too many different things, you can't even hear your own intuition,
Right.
right? So
Hmm.
start quietening some of these voices. You're not going to miss anything. You're not missing out. Start quieting some of these other voices so you can hear yourself and guide yourself.
Absolutely. Let's talk about beauty. So, what are some of your favorite beauty products personally?
Oh my gosh, you need to wear sunscreen. Okay. First of all, you need to wear sunscreen. And sunscreen's not just like a summer thing, it's like 365. Okay.
Hmm.
Um, honestly, that is like not only for your cancer risk, but for beauty, right? Like if you want to save your face, save your hands, like Lord, think about like if you ever get gel manicures, you're sticking your hands in those UV lights, put
Right.
sunscreen on your hands before you go. Like that is my number one. That would
Hmm.
be Like if the house was on fire, that would be the one beauty product I would grab, grab the kids, grab the sunscreen, we're out of here, right? Okay. But
Right.
in terms of other beauty products that I really love dry brushing for cancer
Mm,
survivors. It's not only great for like the health and beauty of your skin, but also for lymphatic flow in your
mhm.
body. So I love dry brushing.
I want to get into this next question. So, how would you define beauty in your perspective?
Oh God, beauty is like being comfortable in your body. Like
Mhm,
that's truly what it is, whatever it is to you.
mhm,
Whenever I work with clients, I would never set goals for them. I always say like, here are some goals that women come to me with. What are your goals? Right?
mhm.
Do you want to gain weight, lose weight? Do you want more energy? Like, what do you want to be able to accomplish with that energy? And if
Right.
someone comes to me wanting to change their body weight, um, I tell them, like, what's your goal? And quite
Mhm,
often people will say to me, well, what should I be? And I'll say, okay, well, you know what? Think back in your life when you felt like really healthy, really comfortable. Was there a weight associated with that? Okay. And let's work off of that instead of using like outdated metrics like BMI to try to determine what the standard is for health. Let's like ask you because you know what's best for your body.
mhm.
So I really feel like beauty is being comfortable in your skin and being able to do all the things you want to do without like physical or mental limitations.
Yeah, absolutely. So, what advice would you give for someone who finds out that they have cancer?
Mm. I always say this. This is going to sound totally crazy. Okay. The first thing you should do when you're diagnosed with cancer is go to the gym. Because
Mhm,
the reality is you're going to have to endure some treatments here. You're
mm,
probably going to need some sort of invasive treatment to get rid of the cancer, whether that's surgery, maybe it's just radiation, maybe it's a combination of surgery, radiation, and chemo, but your body's going to undergo some trauma and you want to be as fit as you can going into that trauma because that's going to help you with your recovery. So if
mm,
you haven't been going to the gym, like if you haven't been strength training or walking or working out, start. Start now cuz like the reality is you're going to be a few weeks. You're going to be probably 6 weeks before you're able to start any treatment because you're going to be need to be diagnosed and staged and you're going to have to wait for surgery time or whatever it is. So start. You've got time, so start now.
mm. I want to get into the next question. So, like, in regards, so in my generation, what I've really seen on TikTok is that there's more people getting tested for different cancers.
Mhm.
So because usually with colonoscopies or endoscopies and things like that, that's usually for someone who is older,
Yeah.
40s, 50s. But what I'm seeing and what I'm observing is with my generation, 20s or 30s, is that people are getting tested, but there are some in my generation that are getting diagnosed with colorectal cancer or stomach cancer and things like that. So what is your take on just within my generation and how the health system has impacted like my generation, especially in terms of diet, especially in terms of those types of things, but also how important it is to get tested.
So I think we're seeing an uptick in the number of younger people being diagnosed
Hmm.
because of a few things. We know that our screening and detection strategies are improving. And that's what you just alluded to there, right? Like you see on TikTok, more people getting tested at a younger age. Well, so lots of people will say, like, oh, our environment is toxic. That's why young people. And it's like, yeah, maybe. But you also have to consider that people are just more proactive with their health now. And that's
Hmm.
what you just said, right? So that's why we're seeing an uptick in younger diagnoses, which is troublesome, right? But it's also like a good thing because the sooner we can catch it, the more easy it's treated, right?
Hmm.
So, in terms of like screening, I think the biggest piece of advice I can offer is to know your body, like be familiar with your body. And I think women are especially poor at that. Like,
Mhm.
you should be looking at yourself naked.
Yeah.
Like, take a look before you get in the shower, and you should be doing that regularly. And we talk about self-breast examinations lots,
Mhm.
right?
Yeah.
But, like, overall, like, if there was a different bump or a mole or something's different, like, you need body familiarity to be able to advocate for yourself. Because if you're
Mhm.
like, "Oh, I never noticed that there. I don't know how long that's been like that for. Oh, well." We don't wanna fall into that situation. So, I would say that's where I would start, is, like, just being
Mhm.
familiar with your body.
Absolutely. Last but not least, where can people find you on social media, and how can people support you and what you're doing in terms of the Cancer Freedom Program?
Yeah, so you can find me, Dr. Amy Cancer Recovery. I'm most active on YouTube and Instagram. If you wanna work with me, you're welcome to check out cancerfreedomprogram.com, or you can message me on either one of those platforms.
All right, that's absolutely good. Well, thank you so much, Dr. Amy, for jumping on. I love what you're doing. I found out about you on YouTube and I think on TikTok as well. And I think what you're doing is very positive in terms of helping other women overcome cancer. Also to just prevent cancer, also in general. So I think I really enjoyed like this very productive and informative conversation. So thank you so much.
Thanks for having me here.
Yes, absolutely. Take care. Bye bye. Hello, everybody. Thank you all so much for watching. Please like, comment, share, and subscribe to the channel. Be sure to click the bell for notifications. Also, follow me on my social media platforms and be on the lookout for more interviews to come very soon. Take care, stay healthy, and stay beautiful. Bye bye.